Hi, my name is Valentina, and I'm a fourth-year student of biomedical engineering at the University Pompeu Fabra. My bachelor thesis is about the creation of a training application that, with the help of augmented reality, prepares the surgeons for minimal invasive fetal interventions. The surgical intervention we will focus on is laser photocoagulation therapy. This is used to treat, among others, twin-to-twin transfusion syndrome, which can also be found as TTTS. It's for in short. So this syndrome affects about 15% of monochorionic pregnancies and happens when the fetuses have connected vessels between each other at the placenta. These connections are called anastomosis and connect the umbilical cords and vascular systems of the twins. Because of this, the blood is disproportionately distributed from one, which would be the donor, to the other, that would be the recipient. This will cause an uneven growth between them and is extremely dangerous. So because of this, it should be diagnosed and treated as soon as possible. The diagnosis of TTTS is done by ultrasound and magnetic resonance imaging. And the treatment, as mentioned before, is laser photocoagulation therapy. This consists in burning all the connected vessels and by separating the circulatory systems of the twins. The precise location of the anastomosis is not known before the surgery. This, summed with the narrow motion of range of the fetoscope, makes it very difficult and risky for the performance of this intervention, which has to be planned very, very carefully in advance. So for the pre-operational planning of this, the symbiosis group of the UPF, in collaboration with Hospital Clínic of Barcelona and Hospital Sant Joan de Déu, developed a tool that automatically, with the use of deep learning methods, segments in 3D the tissues of the mother's womb. During my bachelor thesis, I revised the existing ground truth and trained the algorithms in order to test the accuracy of the automatic segmentations. And also I helped in the developing of another app that will complement this tool by training the surgeons to perform this intervention, as it's very difficult and needs a high level of experience. For the developing of the app, I work in collaboration with another student, and I take care of the recording of the operation room and the main surgeon performing the intervention. For this, I use Kinect sensors that record the scene in 3D, and with the use of an algorithm and a special program, I extract the skeleton of the moving surgeon. The skeleton is adapted and introduced in a virtual environment in which, with the help of augmented reality glasses, will guide the trainee to record the effectiveness of the app and what we are performing. We will do tests in which we measure the improvements made by following this 3D guide versus not following it. So thank you for listening. Bye.